Atmanirbhar Bharat in this area. Health is an accelerator for economic development, and the right healthcare outcomes are crucial for us to achieve a healthy, successful India. Right now, we are the capital of multiple non-communicable diseases. More than 60% of mortality is coming from NCDs, and we do have significant gaps in providing healthcare to the people. There are some laudable schemes that we have done. The Honorable Prime Minister, the Ayushman Bharat scheme has been an exceptional world recognized scheme to ensure that millions of people get access to healthcare. I think we need to support it actively. We need to support in education training, and how PGMER, Chandigarh and the teams are doing excellent activities are laudable. What ICMR is doing is laudable. What Jitendra Sharma ji and teams are doing in the MTZ and Kalam Institute of Health Technology are also laudable. But we need more spirited individuals, groups to come together to address this gap in healthcare delivery, and at the same time to make India a world powerhouse in the research, manufacturing, and clinical research and allied disciplines around healthcare. So I really welcome everyone, and I'm really privileged to be here. I'm always excited about when Varinder Gagji explains about the aspirations and the plans for the center, for the ICMR Center for Biodesign and Innovation. I'm always excited, and I'm a big supporter, and I really want to work together representing Medtronic and to channel investment and support for this center. So should I start sharing a few slides just to set a scene?
Sir, we are
okay?
Sir, let me introduce all the guests.
Formally once.
Please do.
Sir, we are going live now. Sir. 3, 2, 1.
A very good morning, distinguished guest, Mr. Madan Krishnan, Professor Vinod Kumar, Dr. Jitendra Sharma, Professor Ramesh Loganatham, Shri Amar Shankar Sebal, Dr. Rohit Garg, Shri Ramdev Krishan, Mr. Sushil Rana, Dr. Shalini. Dear participants, ladies and gentlemen, I extend warm welcome to you all to second day of International Summit Atmanirbhar Bharat, India as Manufacturing Hub for Global Healthcare, organized by CIBioD, PGIMR, Chandigarh. We are going to begin with first session. The session is Bharat, Future Global Manufacturing Hub for Medical Devices, Challenges and Strengths. The key points to be covered in this session are India being a future hub for economic growth as more young and trained population is available for new ventures at all technological innovations and investments. Advanced manufacturing units deployment and skill development for the younger generation for future growth. Availability of natural resources in ample amount for establishing high-level manufacturing units for biotechnology, healthcare, and biomedical sectors. More population provides more consumer to the industries for their several kind of products. Some more problems also needs to be addressed, such as infrastructure, roads, electricity, are deferring the foreign investors to invest in India up to some extent. Other problems like crime rate, policy problems, focus areas, red tapeism, and operational glitches need focus. We are honored to have with us presiding guest, Mr. Madan Krishnan, Vice President and Managing Director, Medtronic India. Mr. Madan joined Medtronic in 2011 and is Vice President and Managing Director. He earned his MBA from Solon School of Management at MIT and was an elected member at MIT Solon Senate. He has more than 20 years of leadership experience in healthcare and healthcare systems. His experience includes roles in Turkey, South Africa, etc. He is keenly involved in nurturing innovation-driven and high-performance teams. Mr. Madan serves as chair for MTL and for Advanced Medical Technology Association India Working Group. He is on board of Medical Technology Association of India. He is also member of Medical Devices Promotion Council constituted by Government of India. Welcome, sir. We have our keynote speaker, Dr. Vinod Kumar, Vice Chancellor, JP University of Information Technology, Solan, Himachal Pradesh. Dr. Vinod Kumar was Deputy Director and Professor at Electrical Engineering at IIT Roorkee. He has earned many academic distinctions, including Khosla Research Awards for University of Roorkee, first IETE RS Kanpur Medical Instrumentation Gold Medal 2006, Railway Board Award for the Best Paper, K.S. Krishna Memorial Award for IETE, the Bridge Mohan Lal Award for IE, the Corps of Engineers Prize for IE, Best Paper Certificates, Best Teacher Awardee of IIT Roorkee, and many more. Professor Vinod Kumar has about 180 research papers to his credit. He has guided 28 PhDs, more than 150 MTech dissertations, and more than 150 BTech projects in the area of medical instrumentation and digital signal and image processing. He has taken more than 90 assignments as consultant in diverse fields. He has 41 years of rich experience of teaching and research and technical education management. He is Life Fellow of IETE and IE, member of IEI UK, and a senior member of IEEE USA. Welcome, sir. We have amongst us keynote speaker Dr. Jitendra Sharma, Chief Executive Officer and MD, Andhra Medtech Zone Limited, Visakhapatnam, Andhra Pradesh. Dr. Sharma comes with an exhaustive experience of supporting the entire range of healthcare delivery systems, from a primary health center to World Health Organization. Earlier, he had served as hospital administrator at Sri Satya Sai Baba Free Hospital in Andhra Pradesh. He is known for leading several projects and health technology and research study in leading institutions from AIIMS New Delhi to WHO. Welcome, sir. We have with us Professor Ramesh Loganatham, Professor of Co-Innovation Outreach at IIIT Hyderabad. Professor Ramesh is an accomplished technologist with over 20 years product engineering and R&D leadership experience. He is a member of several standards expert group and actively involved in product startup circles. He has been adjunct faculty at IIIT Hyderabad since 2002, visiting faculty at IIT Hyderabad Innovation, member of Governing Board of Incubators at IIIT Hyderabad IIT and WITS. He was Center Head and Vice President Products, Progress Software Hyderabad Labs, responsible for leading the product development at the Hyderabad Development Center. He is mainly involved in helping startups and grow technology transfer office, Entrepreneur on Residence Program, and the Center for Innovation and Entrepreneurship. A warm welcome to you, sir. Now we are going to start with the keynote address by Dr. Vinod Kumar. So over to you, please. Dr. Vinod, sir, you need to unmute.
Slide share बंद करो ना. Sir, now you can share your slides also.
Okay. My slides are visible?
Yes, sir, visible.
A very good morning to all of you. A very good morning to especially Shri Madan Krishnan ji, Dr. Jitendra Sharma ji, Professor Ramesh Loganatham, Shri Ramdev Krishnan ji, Shri Amar Shankar Sebal, Mr. Sushil Rana ji, Dr. Rohit Garg, Dr. Shalini ji. I am very thankful to the organizing committee of this summit, especially Dr. Virendra Garg ji and his team that I could get a chance to associate with this group. I'm really very passionate and would like to contribute whatever maximum I can do. My basic research area when I was with the IIT Roorkee for more than 40 years, it was in the area of signal and image processing, especially the signal processing for the medical signals, that is ECG. And in that case, we have developed many algorithms for the analysis of ECG, for the detection of various wave component, as well as disease classification. We have also developed a indigenous database with the help of University of Glasgow for the normal limits of healthy Indian population. Another area was medical image processing, where again we have developed a lot of databases, especially in the area of liver diseases, ultrasound images with the help of PGI Chandigarh in collaboration with Professor Khandelwal and Dr. Naveen. ECG database with respect to HRV, I have done some work with the All India Medical Institute with Professor K.K. Deepak also, and we have a good database as well as algorithms which are being used by many medical institutes. Today's topic I have taken as per the theme of the session, that is Bharat, future global manufacturing hub of medical devices, challenges and strength. I have divided my talk in 5 parts. First is healthcare status. As all of us know that global life expectancy has increased for between 2000 to 2016, as per the World Health Organization statistics, the life expectancy has increased by 5.5 years, that is from 66.5 to 72 years. The dark line indicates from this to this level. Further, there is an increase in healthy life expectancy, that is HALE, at birth, that is 4.8 years from 58.5 to 63.5. This also indicates that this healthy life, that is dark line, has increased. But there is an increase in unhealthy life years from 8 years to 8.7 years, that is light bars. So which indicates that we have to take care of this unhealthy life, where the medical devices, healthcare system will be more important. Now, the reason for this unhealthy life, there are many lifestyle diseases. The cardiovascular is one lifestyle disease, and major modifiable risk factors are high blood pressure, abnormal blood lipids, tobacco use, physical inactivity, obesity, unhealthy diet, diabetes, heavy alcohol use. And if we go through other lifestyle diseases, another is diabetes, which we know that it is a metabolic disorder which affects the way body use food for energy and physical growth. We have 4 types of diabetes. Type 2 is more important, which is more common. And modifiable risk factors are unhealthy diets, physical inactivity, obesity, overweight, high blood pressure, high cholesterol, heavy alcohol use, psychological stress, high consumption of sugar, low consumption of fiber. Another lifestyle disease is cancer. Cancer also affects large number of parts of the body. Basically, it is a rapid creation of abnormal cells. more than 7 million people die of cancer each year. 30% of those are attributed to lifestyle diseases, which are more important for us. And modifiable risk factors are smoking, passive smoking, radiation therapy, living in air polluted space, asbestos, radon, chromium, nickel, arsenic, soot, tar, exposure to all these, hormone therapies. Then another factor, obesity, unhealthy diet, bad food habits, low intake of fiber, insufficient physical activities. Chronic respiratory disease is another lifestyle disease, that is CRD, and a potent cause of death globally, but some of the most undiagnosed conditions. 90% of the death takes place in low-income countries. Again, modifiable risk factors are smoking, dust and chemicals, air pollution, infections. So this indicates that there is a demand of large number of medical devices which are of point of care type, and there is a lot of improvement required in healthcare services also. The second part is strength. What are our strengths to become a world hub for manufacturing medical devices? Our strengths are, from the economy growth point of view, India is sixth largest economy in the world according to nominal GDP, that is 2.6 trillion in the year 2020-21. Third largest economy by purchasing power parity, that is PPP, 8.7 trillion market in the year 2021. India is sixth largest manufacturer in the world, 3% of the global manufacturing output, and employs over 57 million people. Major exporter of IT services with 180 billion revenue, employs over 4 million people. World's second largest telecommunication industry by number of mobile phone, smartphone, and internet users. Data is very cheap here. Mobile data plans at an average rate of 20 per 1 GB, etc., whereas the global price is much more. Large labor force and availability of cheap labor force. World's second largest labor force. We have the manpower, we have the economy growth, and this economy growth is linked with the technological growth also. In India, we have more than 6,000 engineering and technological institutes, that is at BTech, MTech, PhD level, and at diploma level. 1.9 million students enrolled for engineering and diploma courses in the area of ECE and CSE in the year 2019. Large number of engineers are employable. We have 50%, more than 50% of young population below the age of 25. More than 65% are people below the age of 35. Young population in India has reasonably high technological awareness also. India is known as world's leading outsourcing destination for global companies. Reason being low cost, outsource software and sports services, and the value is of the order of $150 billion. We have improved our rank of World Innovation Index from 81 in 2015 to 52 in 2019. In 2019, India ranked third in the world in terms of attracting investment for technology transfer. So that means we have the technical power, manpower, we have the young generation, we are economically sound from that point of view. And the another aspect is government is also very supportive. The government initiative, that is Ayushman Bharat, it's a flagship scheme of Government of India to achieve the vision of our Honorable Prime Minister, that is universal health coverage, designed to meet sustainable development goals with a commitment of leave no one behind. Everyone should be provided with medical care. Moving from sectoral and segmented approach to a comprehensive need-based healthcare services. That is, it is not isolated type, but it's a comprehensive need-based healthcare services. Holistically address the healthcare system, that is from prevention, promotion, and to the ambulatory level. Again, at the level of primary healthcare, secondary healthcare, and tertiary healthcare levels. Ayushman Bharat, with this, health and wellness centers are more important. That is why creation of 150,000 health and wellness centers by transforming the existing sub-centers and primary health centers to deliver comprehensive primary health care, bringing healthcare closer to the home of people. Emphasis of health promotion and prevention. Focus on keeping people healthy. Reduce the risk of developing chronic diseases and morbidities. These are the aims of this Ayushman Bharat. And in this particular scheme, we have Pradhan Mantri Jan Arogya Yojana, that is to give a health coverage of the order of 5 lakhs per family per year for secondary and tertiary care hospitalization. Around 11 crore poor and vulnerable families will be benefited, and total beneficiaries are of the order of 50 crore. This is world's largest health insurance and assurance scheme, fully financed by Government of India. Covers up to 3 days of pre-hospitalization and 15 days post-hospitalization expenses. There is no restriction on family size, age, or gender. All pre-existing conditions are covered from day one. Now, along with this, the Government of India has taken stand to encourage electronic hardware manufacturing. That is, hardware manufacturing of electronics is given high priority, the National Policy on Electronics 2019. It is also considered as one of the important pillars of both Make in India and Digital India. Demand for electronics hardware is projected to about 26 lakh crore by 2025 rupees. Greater need of medical devices, point of care testing devices, even we have felt in COVID situation also. Now, looking into this, there is an opportunity, there is a demand. Healthcare market in India is expected to reach $372 billion by 2022. That is 37 lakh crore. While medical device market is expected to cross $11 billion by 2022. So all this contribute because of the rising income, greater health awareness, lifestyle diseases, and increasing access to insurance. All this contribute to the growth or to the scope of making India as a manufacturing hub for medical devices. Investment in healthcare infrastructure is set to rise. From all this, we can say very definitely benefiting both hospitals and R&D and education infrastructure. Hospital industry in India is expected to grow average growth rate of 16 to 17% to reach 8.6 trillion by financial year 22 from 4 trillion financial year. In 5 years, we are expecting that the market will grow to the double. So government is supporting healthcare services. The government aims is to develop India as a global healthcare hub, creation of new drug testing laboratories, further strengthening of 31 existing state laboratories. World's largest government-funded healthcare scheme has already been launched, AYUSHMAN Bharat. So we have a market, we have our strength. Government is also helping in this particular mission, and the technological solution is also available with us. That is, what type of devices are possible where India can be a manufacturing hub at world level. That is, affordable and user-friendly health monitoring systems are required, maybe for vital parameters, blood pressure, blood sugar, BMI, oxygen level, cortisol. We need apps for smartphone application which can govern, which can immediately guide each and every individual whether he needs further investigation or not. Remote access to telemedicine and mobile healthcare, which we have already observed during pandemic, that telemedicine and mobile healthcare are very, very important and need of the day. Managing the massive volume of patient data, that is, we have large number of patients, we have large number of large data also, which we have to manage. So we have to develop the algorithm. There is a market to use this data for proactive actions. Artificial intelligence is also playing a major role in developing the devices with intelligence. Internet of Medical Things, hybrid closed-loop insulin delivery system, non-invasive diabetes monitoring system. So there are good number of equipment for which technological solutions are also available. So the manufacturing and marketing is to be developed. Further, we have to see that government funding for research and development is increased because the government is very much willing. Advertisement awareness program should also be highlighted. More emphasis should be given so that some of the lifestyle diseases can be taken care. Promotion of healthy food and lifestyle practices, promotion of yoga, role of government agencies, role of NGOs, way to improve mental health. So this also develops a market where India can be a leading country in world for providing healthcare solutions. Point of care is another devices where India can be a manufacturing hub. That is, the point of care devices are designed to be used at or near the site where the patient is located. Allows rapid and reliable diagnostic testing in which outcome can be obtained instantly. Like this rapid antigen tests are being done. The reports are available instantly. So similar type of point of care devices are required. We have 12 categories of point of care devices, glucose monitoring products which are available on the counter, and large number of people are using at home to regularly monitor their glucose. Cardiometabolic testing products like cardiac markers, glucose, and HbA1c, cholesterol level. infectious diseases testing kits are available: influenza, HIV, hepatitis C, respiratory infection. Coagulation testing products are available, that is prothrombin time, PT or INR, this is international, normalized ratio, etc. Clotting time, pregnancy and fertility testing products are available. Fecal occult testing products are available, that is screening of patients for colon cancer, that is to check for blood in the stool, which is not otherwise seen by naked eye. Hematological testing products, tumor cancer marker testing products, urine analysis testing products, drug of abuse, cholesterol testing. Large number of point of care products are available, and there is a huge market for this. It is expected that the adoption of POC diagnostic product will increase. High prevalence of infectious disease in developing country will also develop a market. Increasing incidence of target diseases, rising preference for home healthcare across the globe. This is also a major component. Glucose monitoring products, OTC testing segments, that is on the counter, to witness higher growth. Home care to witness highest growth. So there are large number of other point of care test devices for which technology is available, and it is available in the market. Some are at a very high cost, some are at very reasonable cost, where there is a scope to manufacture all these kits in India. We have antibody test kits which have already been approved by FDA for COVID-19. We have antigen test kits, which are also a rapid antigen test kits, which are also available these days in the market and being used in large numbers. We have molecular test kits, which are available, like RT-PCR, which is very commonly used these days. This is slightly costly and takes more time, 24 hours to 48 hours or so. Another scope is telemedicine. Through telemedicine devices, through telemedicine software, so that a patient can be provided medical care in the remote area. This is also important for image transmission within and among healthcare organizations to transfer the images like ultrasound, MRIs, X-rays, etc., CTs, etc. Now, AI is also being used in medical imaging, which also creates a huge market in India. That is, AI is being used in magnetic MRI, computer tomography, interventional radiology, trials, aided reporting, follow-up planning. This artificial intelligence has been already in use, and research and technology is also available. The challenges are because patient populations are aging or increasing, which means that volume, complexity, and resolution of images are increasing, but the size of radiology workforce, radiologists, is almost flat, is not increasing. So we have more load with fewer person. AI will be able to provide pre-screening or pre-analysis as a co-pilot, helping radiologists to focus attention on urgent and critical care patient. Another solution is machine learning methods are being used in all areas of medical imaging. Deep learning models are being used to take care of speed and accuracy of analysis. High profile areas like detection of lung nodules, brain cancer, multiple sclerosis, breast cancer, prostate cancer, and liver tumor. In all these cases, the AI and machine learning and deep learning models are very much in development and is being, the use of these has already been started. So some of the AI powered diagnostic techniques which are available, smartphone mounted device for retinal imaging, whether the patient has to go immediately to ophthalmologist or not. Various annotated databases are also available in the area of CT, liver lesions, ultrasound, and many more. AI is in use in medical imaging. It is somewhat similar to automated aircraft, aviation, or driverless vehicle, etc., etc. There are large number of therapeutic devices which also create a demand, and where manufacturing facilities can be created in India or already available can be augmented. So I can just conclude that global health status have improved in terms of life expectancy, healthy life expectancy over the past 2 decades, unhealthy life years increased too, which poses many healthcare challenges, that is lack of basic medical facility. So here we have the scope, lack of healthcare professionals, lack of awareness, affordability. So here also if we can provide them cheap solutions. Patient populations are aging, which means volume, complexity and number of cases are increasing. So more number of healthcare workforce is required, but we have workforce flat or shrinking. So more load with fewer personals. So AI can be another solution to take care of this load. Point of care devices, telemedicine, and last one, the awareness by government and NGOs. So AI in automated analysis and decision making, deep learning and machine learning for fast diagnosis and analysis, cloud computing architecture, etc. They are again raising the scope for India to go manufacturing of devices as well as development of apps for the use of medical healthcare. So this is what I just wanted to share with all of you. With this, I close my talk. Thank you. Thank you very much.
Thank you, Professor Vinod, for a delightful presentation and giving an excellent coverage on different aspects. Thank you very much, sir. Now I invite Professor Ramesh Loganatham to share his views on the theme. Professor Ramesh.
Thank you, madam. Can I present? I can share my screen time. Okay, thank you so much. I'm very happy to be here.
That is fine.
Can you hear me?
Yeah, we can hear you.
Okay, sorry, yeah. So very happy to be here at this conference organized by PG Institute Chandigarh. I've always heard so much. I've held the institute in awe all these years, and I feel it's an honor to be asked to speak.
Professor Ramesh,
yes.
You need to increase your volume.
Okay. Yeah, let me do that. So, so I'm very happy to be here talking at PGIM event. I'm going to be talking about just one facet of AI solutions, just following up on the talk where I think Sir said a very broad context on where all AI could be used. So I'm going to talk about one facet of AI that is not, one facet that makes it so hard to make AI solutions work, which is medical data sets. We have been, AAIT Hyderabad is the leading institute for AI. We have one of the largest research groups for AI in the country. The first AAIT to have been set up back in '98. And it's a research university. We have, like many of the areas of AI, we have research groups that rank among the top few in the country. Healthcare has been a focus for us, one of the focus areas for us for a long time. We have a very, very strong computer vision research group. So medical imaging AI is a very, very key part of where AI can be used in healthcare for diagnostics, whether it's oncology or eye care, or even there's one startup we just started engaging with, who's using images to detect different skin conditions. So using images is a very, very key opportunity for leveraging AI for medical and healthcare. Text-based, we've been doing a lot of work around text-based diagnostics. Like it could be like say reading medical reports for insurance or for other purposes. We have a lot of work happening in the area of information extraction, understanding documents and understanding text. That's an area there's been some work happening. Signal processing AI, any kind of sensory data, it could be a digital stethoscope or it could be any other form of data coming in, again, automatically diagnosing and interpreting those signals. Again, AI comes into play. There are a lot of solutions around ECG and other heart monitoring, different heart conditions. So the possibilities are kind of galore, but not enough solutions happen. I mean, recently we started a large applied AI initiative with support from Government of India, DST, Government of Telangana, Intel, and also Public Health Foundation of India. So the first time we're getting into it in a little bit more organized way. So I'm going to talk about that a little bit in the next 15 minutes or so. So these are some of the areas that we identified like in recent months in terms of where all AI can help when it comes to healthcare. So obviously, diagnostics is one key place where a lot of possibilities arise in terms of using it. Could be low-cost diagnostics, it could be assistive diagnostics, where a radiologist or a histopathologist is assisted to speed up their analysis. So technology-assisted diagnostics, could be precision diagnostics. There's some things that AI can detect very, very well, some very subtle points that a human eye can miss out while reading an image, for instance. AI could detect those. And of course, low cost and rapid when it comes to tier 2 towns and rural healthcare and such. Low cost and rapid diagnostics. So diagnostics is a big area where AI can help. The whole health services optimization is again an area where AI can help. When it knows large amounts of data, trying to analyze different trends, could be regional trends, local trends, hyper-local trends, and then help and assist preventive healthcare. One area is like individual specific. If you can get enough data at the broader macro level as well as at the individual level, there can be very, very targeted health solutions for each individual. So that's another facet that we've identified. The whole proactive public health, like preventive, right? I mean, like instead of waiting for something to happen, can we even prevent the onset of a disease or a chronic medical condition? And then the treatment protocols, a lot of model-based, like whether it's computational chemistry or like modeling of the various molecules, or even understanding of genome sequences and such. Like AI can be used, or mathematical models can be used to detect treatment protocols. So these are some of the areas that we identified. Now, there's startups all over the world, right? I mean, startups is one way. A lot of these technologies finds its way from research into being used. We have very large incubator at AAIT, one of the largest tech incubators in the country. We have focused with support from DBT, BIRAC. We have a medical focused incubator as well. And still, if you look at the global list of startups, the CB Insights had published earlier, like last year, there's just only one startup from India in the global 100 AI startups list. Now, there are some startups like CIBioD that's in Pune, Siktapal, and Ekincare, which is a Hyderabad-based company. There are some startups that have come up, in recent years, but the very, very small number. And none of them have made it to the global scale yet. Sick couple to some extent maybe, but very few have made it to the global scale. And why is it so? I mean, we have very, very large tech talent. We have very, very large medical talent as well. Leading institutes like PGMR and AIMS and such. This top quality understanding of medical domain. We have huge healthcare ecosystem, and yet the technology solutions coming out of India that can help medical space is very, very limited, very small, and just beginning to happen. These are some of the challenges. As I mean, from our analysis, while there are tremendous opportunities, whether it is diagnostics or tests or risk profiling and such, few key problems. The first one is like there's low awareness of problems. Like, I mean, the medical domain understands the problems that are there. The technology domain understands technology, but understanding of what technology can solve what problem, that is something that is very, very, the awareness is very low. Medical domain understands problems, but don't understand what technology could address. Technology domain understands technology, but don't understand the problems that are there that technology could address. So net, the ecosystem that can solve this problem, the awareness of the problems is very, very low. So often we see startups picking problems that are probably not that significant in its impact. While if they understood better, they could have picked some other problem in a related area where the impact is much higher. The data sets are very hard. When it comes to AI solutions, data is very, very important. If you talk about like trying to diagnose, like for instance, if you want to, the mini startups trying to diagnose COVID from X-rays. Now, unless they have enough COVID X-ray data, and COVID X-ray data are different stages of kind of the whole, the progression of the virus, the algorithm is not going to be accurate. Now, there are startups that are trying to do it and are struggling to get India COVID X-rays. So the data sets, anything you do, whether you talk about cancer diagnostics or you talk about treatment protocols or risk profiling, any of those aspects, the data sets are very, very important. And that is very, very hard to combine in India for all kinds of reasons, partly regulatory, partly the hospitals are very busy doing their own core operations. So this is not a priority for them to compile this data. So in effect, what happens, the medical ecosystem has all the data, but startups that need the data cannot get it, or the innovators that need the data cannot get it. Innovators know how to do stuff, but they don't have access to the data. So, the data sets is a very, very big problem. And the most significant challenge, we have a much, much better understanding of it now in the last 3-4 years since we started our medical technology incubator. So we're looking at how can research that comes out of our research labs, how can it find its way into the domain to solve medical problems. Now, as we got into it, we realized that like this combined understanding is key, and that is very, very hard to combine. I mean, the medical profession doesn't understand technology, and the technology profession doesn't understand medicine. So just precisely for that reason, when we started a medtech incubator, we said the person running our medtech incubator will be a healthcare life sciences person. So we had somebody, both the people that ran it in the last 3 years are postdocs in biochemistry and such in the life sciences space. And we said that way, we will bring that in, but it's still, while we can facilitate the process, it still doesn't happen as easily. So, we said like, can we solve at least one problem? And we said, let's take the medical data set. So this is something we've been thinking of for some time now. For the last couple of years, there are some very interesting projects happening also. There's the first Brain Atlas project that's happening along with the Sri Chitra Institute in Trivandrum. Dr. Valiathan himself, even at this stage, is actively involved in driving that project. So we are using the whole medical imaging AI to build a Brain Atlas, and based on that, create an interactive system to teach neuro to undergrad medical students. Now, that's Dr. Valiathan's vision, and we're helping do that. We've done a lot of work around eye in the past 15 years or so, working with both Aravind Eye Hospital as well as Selvi Prasad Eye Institute here in Hyderabad and Aravind Eye Hospital in Madurai. We do a lot of work around eye. We have a few professors that are looking at oncology, like diagnosing different from different radiology images, trying to understand, trying to diagnose different conditions. We have a startup that's working with one of our professors where they're trying to use like AI to detect from histopathology, from the slides, to detect different oncology conditions. So we've had different efforts, but like in that process, we realized that like to practically get a solution, or where a lot of research happened, we almost don't have a single solution that's come out from our research. Even as we are working on actual eye problems, working with hospitals like Lily Prasad or Arvind Eye Hospital and such, still no solution has come out. And that's mainly because of having getting data for research is easy, getting data for innovation and commercialization is almost impossible right now. And so we said, like, let's put a very concerted effort around creating data sets. And while we've been thinking about it for some time, we got a serious opportunity post-COVID. So where like DST with support from ICMR was trying to create a medical data sets for COVID data. And we got the opportunity to build that out. So, and in fact, now that's becoming a much larger initiative to create a medical data sets, data bank itself for different conditions, starting with COVID. But the idea is to create a large data set bank for different medical conditions. So we're just starting to talk about building a data set for diabetes. And then like we are trying to build this data set for, like I said, the whole brain atlas is the other data set coming up. And so we want to build out a set of data sets which are available for research and innovators. Could be startups or technology companies, other companies that want to build solutions. So this data would be available for innovators to build their models or to test their solutions. So Curate and Create India data sets, a lot of, if you look at any innovator, any startup in the country building AI solutions for healthcare, they would build their solutions using data from other countries. Very hard to get data within India. So that's what we hope to build, Curate and Create India data sets, a platform to create research medical innovations. Now, if we can work with the medical fraternity and we can create the right data sets, accompanying the data sets would be the relevant problems that's worth solving. So once we get the data sets, we also hope to run challenges and challenge startups or innovators to come and solve those problems. So relevant problems now can be taken through the challenges on the platform. Now, and then of course, once we have this data, more research groups will have access, and we hope we can also enable high impact research. So those are the objectives of this, the AI MedHub or Medical Data Hub that we just started to create. So we'll develop the whole data sets, we'll make it available, deploy it on a web accessible platforms, enable expert teams to seek solutions, right? I mean, whether it is on the medical side or on the technology side. Provide anonymous data. That's a very important privacy protected anonymous data to research groups and developers and data scientists. So the technology side, make medical data available. And like I said, host challenges. We will run challenges for relevant problems once the data is available. Like once COVID data is available, and if I mean, a lot of the problems are already solved, but I'm sure there'll be some more problems we may want to understand, some treatment efficacies or risk profiling. We're already doing one project on risk profiling. So the moment a patient walks in, based on the initial vitals and initial tests, the system will profile the likelihood of that person developing complexities. Now, so once we get more data, we'll host challenges. Right now, our own research group is working on it. But in the next few months, we're going to host challenges where anybody can come, take the data, and try and solve the problem that's being posted as a challenge. So that's the goal of the whole AI MedHub. Data, like if you look at the whole pipeline of data, every aspect of data is hard, starting from understanding where the data is, getting the permissions for the data, then sourcing the data, getting it in digital form, validating it, curating and validating the data, and then enriching it, annotating, like if you look at X-ray images or other images, yeah, the marking out the different aspects of the image that leads to a certain condition is very important for algorithms to be developed. So this whole pipeline is very hard, and that's what we hope to do in the MedHub. We're trying to build that complete pipeline and get it to a point where the data that is finally hosted, that's available for the innovators, startups, and other innovators, is in a very usable form. So the data collection, and we also believe that, well, right now for the COVID data, we are working with Gandhi Hospital, which is a nodal hospital in the state. And we are doing post-fact. We got the medical ethics committee approval back in May itself. And but took quite some time. It took 2 months. I mean, the process, we are seeing first person, how hard it is to get the data. We got the permissions very, very early on. Now, after getting the ethics committee approval, just to get the letter on hand took us 5-6 weeks. After the committee met and approved, just to get the letter on hand from the ethics committee, it took us 6 weeks. Once we got the letter, we were to get access to the case files. So we put a large team. We have a 15-member team from the medical side. I mean, AI side is separate again. We have doctors, we have nurses, we have others that are going to go validate this data and get it into a digital form. Now, we have the team in place, but getting access to the case files, it's a retrospective study. Getting access to the case files took another 4-5 weeks. So after the in-principle approval or the ethics committee approval, it took us more than 3 months to get access to the case files. It's still not data. These are physical files. And then we started scanning the files, and then we had doctors and others look at it and try to make sense and get it into a digital form. To get that in a form that is machine readable, it took us almost 2 months to get the first set of usable records. So from what we would think, the moment the ethics committee is approved, we would think that we can start getting data in the next 1 or 2 weeks. It's taken us 4 months to get the first set of first few hundred records. And now, of course, it's streamlined. So now we're getting about 200 patients records every week. It's a longitudinal study. As long as they're hospitalized for the 7, 8, 10, 15 days, there's daily data for each patient. So we can do a lot of time series, progression studies based on how the virus progresses in different patients or how the treatments are working on different patients. So, in fact, we don't have any public COVID data set and much less a data set that has the progression time series data for each patient. Now, we still haven't started the work. We just start getting the data. We're getting it into the system now. And we still are looking at the last phase, which is kind of now looking at it and the basic cleanup has been done. Now they're still looking at some final curation to validate, make sure the data is right. And so this whole process is very, very hard. And we believe we have to get tools to make it easier. So we want, if you talk about data sourcing, we have tools that can go help collect data. This whole thing we're doing with case files today. It's a manual process. Somebody is scanning it, we're getting it because large team cannot go work from Gandhi Hospital. So we're scanning the case files and then in a different place, the team is sitting and then opening the images. And then it's a very manual process. Can be automated. Can we have a patient kind of an anonymous ID and then the images come in against that ID? Somebody can open it and everything that they read from it automatically gets entered against that ID and then gets anonymized and then goes for validation and enrichment. Now, we have to build these tools. Now, starting from, like I said, sourcing the raw data to getting it in the proper digital form, cleaning it up and annotating with the required kind of markup on the data that can be used for mission processing. So this is a pipeline we're trying to build. And we hope that once it is built, maybe in the next 6 months or so, we can start collecting data more quickly. If you sign up with the hospital and the hospital is willing to help us with it, the tools will be available where they can start putting the data in. And so that's where we hope to get in the next coming months. So there's one thing we realized is the cost of data, we didn't know earlier, and we were surprised at how expensive it was. And after talking to multiple, IGB in Delhi is helping with this, CCMB in Hyderabad, IIT Kharagpur, and few other doctors and groups that have worked with data collection already. And almost the unanimous view is that it's roughly it takes anywhere from 5 to 10,000, sometimes even more per record. The cost of collecting data is very high. So we're talking about 1,000 patient data for a certain disease condition. It might be tens of lakhs. The cost, because you need to there's the sourcing itself takes some effort and resources. The biggest expert, the medical team that needs to look at it to understand the data and then translate that into a digital form. Now that's and then the team that's required to get it into digital form itself, to understand the data and then get the numbers and the meaningful data out, and then a team to go get it into the digital form in whatever file structure, wherever the data needs to be entered. So we've kind of got a sense of what it might take to get this data in, and we're trying to create a pipeline that can help optimize this. So we've started off with COVID. So we have the Gandhi Hospital data that we're collecting here. There's an exercise happening in Delhi, which data also will come on the same platform. IJB is doing it around X-rays specifically. There's another initiative where CCMB, IGB, and IIIT are involved. It's funded by Intel to create the genome sequences of COVID. So both the virus as well as patients, COVID patients. There's another effort that is on. So this way we are starting, and then we hope to kind of get more data as we go. So this is the plan. I'm not going to go into the plan. The platform is being built, the whole pipeline. The hope is that like we can even build some other layers of tooling on, like for instance, all the medical imaging that's coming from an X-ray or CT scan or any medical imaging. There are standard ways of marking up. So we're trying to build some of those tooling as well for curation and annotation of the data. And the data collection is already started and the hosting has started, and the curation we will build as we go. So that's a quick, I just want to present one facet of what we are doing and then impress upon the fraternity, medical fraternity. The data is the hardest part of the problem, and the second hardest is understanding what problems to solve. And would look for collaboration. I think only when the technology side and the medical side actively collaborate, we should be like very accurate. It's not like the medical fraternity can define a problem and give it off to the technology side, and technology side can solve it. It's not that simple. Because even understanding the problem, understanding the nuances of the problem, understanding how to solve the problem, understanding what data is required to solve the problem, and this whole process needs very, very continuous collaboration between the medical side and the technology side. So would love to see some possibilities happen with PGIMER as well. Thank you so much for this opportunity to share some of what we're doing at IIIT Hyderabad.
Thank you, Professor Ramesh, for nice and insightful presentation on data sets and use of artificial intelligence in medical domain. Thank you very much. Now I invite Dr. Jitendra to share his views on the theme. Dr. Jitendra.
Good morning, everybody. You can hear me?
Yes, sir.
Lovely. So, good morning, friends. Mr. Madan, happy to see you again, colleagues from PGI. We have had two very good presentations, very elaborate and very comprehensive presentations. So, I'm not going to bore all of you with a third one. I just have very few thoughts and a very small video of what is achievable. My thought that I want to share with you is from a layman's perspective. India's medical device market of 55,000 crore per annum is made of what? If you see from a commoner's perspective, medical devices, scientifically, they are in 7 segments. The rehabilitative aid, the implants, the electronics, the IVDs, and so on. From a regulatory perspective, they are in 4 verticals, the class A, B, C, and D. But from a citizen's perspective, how do we classify medical devices? Because a citizen does not understand the regulator's risk-based classification, does not understand the nuances of technological description. A citizen is only seeking health. So, from a health-centric citizen perspective, how do we define a medical device? The medical devices from a societal perspective are of in 3 baskets. Medical devices that cure diseases and save life, right? In our 55,000 crore of market, medical devices that save life and cure diseases is about 35,000 crore per annum. The next is medical devices that neither give health nor save life. They only tell you whether you are healthy or not healthy, like diagnostics and radiology. Mind you, these devices don't save lives. They neither promote health. They only classify you as healthy or non-healthy. And these devices are diagnostics, which makes about 15,000 crore in Indian market. Our market size 15,000 crore is made of devices that tell us whether we are healthy or not healthy. And then we have devices that promote health, like wearables, like spirometry, like physiotherapy, like obstetrics and gynecology instrumentation, labor beds, and so on. So from a social citizen perspective who is seeking health, how does one see medical device? It's a big 55,000 crore of cloud in which 35,000 crore per annum is going on devices that actually cure diseases. 15,000 crore on devices that are telling you whether you are healthy or not healthy, whether you have a disease or you don't have a disease, and about 5 to 7,000 crore on devices that actually promote health. Now, as a country, if we have to target this 3 verticals, we have to invest accordingly, right? Because only when we invest accordingly, we get the gains from these big verticals, 35,000 crore, 15,000 crore, and say 5,000 crore. But our investment pattern is just the opposite. We, in our R&D, a large amount of R&D is happening on devices that are of wearable nature, digital nature, that promote health, which is good, but is not the answer to the devices that are actually the burden on the economy today and the burden on the families today. Because you see, when a cancer patient or a heart attack patient goes to a hospital, even under Ayushman Bharat, the hospital is not going to treat that patient using a wearable device or a data bank. The hospital is going to treat that patient using a cath lab, which India doesn't make. That's the burden on the family. So while everything else is supportive, our effort is more towards devices that promote health, which is good, which is certainly very good, but is not the economic solution to our problem. Our next set of effort is on devices that tell us whether we are healthy or not healthy, the in vitro diagnostics and radiology. Now, even during COVID, our industry and enterprises and research institutions have responded emphatically. We have more than 150 COVID diagnostics products today in the market. All of them R&D'd in India, all of them. Just 5 to 10% of our in vitro diagnostics for COVID has actually foreign roots. Continuous work by the R&D teams in multiple institutions have actually led to large number of technology transfers and industrial production of COVID diagnostic kits. I mean, behind me, you see AP MedTech zone. We ourselves make about 3 to 4 lakh RT-PCR kits per day. And that's the capacity. And we have not R&D'd any of it. It's R&D'd by research institutions, transferred to their manufacturing partners. So our substantial amount of effort is going on technologies that actually tell us whether we are healthy or not healthy, which means radiology or in vitro diagnostics. And the minimum effort is going on in the black hole of 35,000 crore, which is technologies that save life. Even today, we don't make pacemakers, we don't make insulin pumps, we don't make substantial number of volumetric pumps and syringe pumps. Even an operation theater light we substantially import. And therefore, my suggestion and the reason why we came up as AMTZ was to give bring balance between the research priority and effort and the economic problem. Because if economic problem is A and the research effort is on C, then A and C will not meet. But if it is proportional, then not only research gets real market-driven agendas and challenges for the research work, but also the country and the hospitals in India get what they use on a day-to-day basis. So if you walk into a hospital today, any hospital, including PGI, including AIIMS, you would see a substantial amount of medical technology, medical equipment, which are non-Indian brands. Now, this percentage, which is about 12 to 13% now, has to grow to somewhere around 50 to 60%, so that we have a trade-off between domestic production and and technologies that we import because of their accuracy and their effectiveness. To do this, we had to engineer a state-of-art system, an ecosystem, which can help manufacturers produce what they want to produce. Mr. Madan Krishnan knows it very well. His company is actually a world leader in many of the cardiac implants, including something as complex as pacemaker. Now, if a pacemaker or an insulin pump has to be made by Medtronic, Medtronic today needs world-class electromagnetic interference center, because these centers actually validate the technology for its safety and accuracy vis-a-vis international standards. And you see, these companies that we see as Medtronics and GEs today, they are not there today because they have a good marketing. They are today because they have stood on the credibility of their product for decades. And this credibility had come by uncompromising compliance to safety standards. And therefore, these agencies, when they develop and they bring a product in the market, they need safety, compliance, and validation systems that are internationally benchmarked. Because none of these companies would like to ethically or commercially take a chance with a substandard product. So what we did is that right from an electromagnetic interference center to a 3D printing center, to a gamma irradiation plant, to a laser technology system center, to a printed circuit board and medical sensor manufacturing center, we set up an entire ecosystem in one campus in India called AMTZ, in which you can actually walk in. You can produce right from an N95 mask, which we produce about 1 lakh pieces a day, to India's first MRI that we produce, because we are the only destination in India that makes a superconducting magnet for 1.5 Tesla MRI. And this entire chain of masks to MRI is a huge journey which goes across ventilators, RT-PCR kits, radioisotopes, multiple product segments, all of which is needed by the country as a basket of services. So what I'm going to do is I'm going to share a small video of 2.5 minutes, and I will request you to let me know if you hear the sound of the video appropriately.
Yes, sir, it's appropriate. Just you have to.
I hope you could hear the sound of the video and the visuals. This is a city of 8 kilometers. Behind me, you see it's AMTZ. It's literally the medical technology capital of India. We have more than 60 partners manufacturing various medical technology products today. 2 incubation centers, one under DBT and one under NITI Aayog, supporting large number of startups. I mean, just to give an example, there is only one company in the world that makes a robotic surgery system. That's Da Vinci Intuitive Surgicals, California. The second in the world is right in that building behind me, RoboSurge. That's where our problem is. Can our patients walk into a hospital and see that the hospital has at least 60% of medical equipment that are made in India? The day we are able to achieve that state, all our efforts, all our knowledge, all our joint work would have found success. I invite all of you, any of you, to come over to Visakhapatnam. You can actually come with an idea in the morning and walk out with a prototype by evening. That's a capability we have in terms of systems, value chain management, component supply, and production. You can come with a prototype in the morning and walk out with a batch of 100 or 200 by evening. And you can come with a batch, take a ready factory, and walk out with millions of units per month. So thank you for this opportunity. Whether you are an innovator or a financer of innovation, whether you are a doctor or a manufacturer, whether you are an R&D specialist or a scientist, AMTZ is an institution that sees you as a family member, because if our experience in today's hospital of seeing foreign products and Indian products only to the extent of 10 to 12% has to become that you walk in, you get good quality products, you get safe products, you get effective products, and you get Indian products. It is to that objective and goal that all of us needs to work together. Thank you for this opportunity, and Jai Hind.
Thank you, Dr. Jitender, for inspiring and stimulating presentation. Thank you very much. Now I invite Dr. Varinder Garg to announce CIBioD Award. Dr. Varinder Garg.
Thank you. Thank you, Dr. Sakshi. Am I audible?
Yes, sir.
You are audible,
Dr. We are extremely honored by the presence of Shri Madan Krishnan, Vice President and Managing Director, Medtronic India, Dr. Vinod Kumar, Vice Chancellor, AP University of Information Technology, Solan, Dr. Jitender Sharma, Chief Executive Officer and MD, AMTZ, and Professor Ramesh Loganathan, Professor Co-Innovation, IIT Hyderabad. So we were able to have a deep plunge into the nitty-gritty of the manufacturing industry in India and their strengths and weaknesses and how we can progress further and what is the way forward for us. And I hope that Dr. Madan Krishnan, Dr. Jitender Sharma, and Dr. Vinod, we will be collaborating in the future also. CIBioD is trying to create an ecosystem in the northern India, as we have a strong technical base in northern India. So the synergy between all of us can also explore the potential here in the northern India. Now I take pride and privilege in announcing the today's award, CIBioD Best Social Impact Innovation Award, which is awarded to Shri Ramdev Krishnan, Head of Business Development, Healthcare Solution, Tata Communication. Shri, it has created a very effective POC for telehealth concept, and it has been a great relief to the chronic patients in those areas. And so we are privileged and honored to have all these 4 dignitaries along with us. Now I will invite my colleague, Dr. Shalini Gender, to introduce the awardees. Thank you.
Very good morning to all. Center of Innovation Biodesign, PGI Chandigarh, and ICMR under ICMR India is determined to make India Atmanirbhar, and is the very our able awardees who are working and impacting and helping us achieve these goals, and it is their determination. Which is helping us achieve what we want to achieve in the near future. So I thank, and the whole team thanks from the core of the heart, and it is a way of thanking that we are awarding their dedication today. So our first awardee for the CIBioD Best Social Impact Innovation Award is Shri Amar Shankar Sable. He is ex-member of Parliament, Rajya Sabha, India. He is honorable and eminent politician with a high impact work in the field of social development. So Shri Amar Shankar Sable, sir. Then our next awardee is the same Best Social Impact Innovation Award, Shri Ramdev Krishna, who is Head Business Development, Healthcare Solutions. He is working with Tata Communications India. He is a keen strategist, planner, and implementer with expertise in devising strategies aimed at enhancing overall organizational work, sustained profitability of operations, and improved business performance. He has 20 plus years of progressive experience in IT infrastructure and managed services. So congratulations, sir.
Thank you.
So the next awardee is Mr. Sushil Rana, Recorder and Medicare Systems Limited. He's the Vice President of Research and Development in Chandigarh. He is a voracious and lifelong learner with a glass is half full mindset. Yes, he has helped us a lot in PGI itself. He is transformational leader with over 20 years of experience in medtech industry in international environment, experienced in telehealth related innovations and affordable medical services. This is a much deserved award to Mr. Sushil Rana. Thank you for all the help you are always giving to us. Congratulations. So nothing is complete without a healer. So here we have Dr. Rohit Garg, a laparoscopic and bariatric surgeon. Mr. Garg earned his MBBS MS General Surgery degree from DMC Ludhiana. He is leading laparoscopic and bariatric surgeon of India. He is currently associated with the Reborn Clinic. So he believes in providing highest quality of care to patients, combining surgical expertise with a personal and honest approach, which is the need of the hour in this much commercialized business now. So congratulations, Mr. Dr. Rohit Garg.
Thank you, ma'am. Thank you.
Shri Madan Krishnan ji, please allow us to confer these awards to the awardees in the virtual mode, because we cannot meet due to COVID. We cannot meet physically, so allow us for the same.
Congratulations, and it's a gratitude from the group, and thank you for the great work. All the best.
Thank you, Shalini ma'am. Now I invite Mr. Madan Krishnan for his presidential remarks.
Thank you. Honorable dear Professor Dr. Vinod Kumar, Dr. Jitendra Sharma, Professor Ramesh Loganathan, Dr. Varinder Garg, Dr. Rohit Garg, all the eminent faculty and the attendees in this session. I will keep my comments at a fairly high level, at a macro level, and we'll share a few slides just to give a perspective on what are some international and local innovations and approaches that we can do in terms of taking healthcare outcomes forward? A healthy India is a successful India. And how can we play a bigger role in our global healthcare ecosystem? The speakers before me, Dr. Vinod Kumar, very well articulated. What do we have, the assets that we have in our vibrant life sciences ecosystem, in diagnostics, pharma, and also the fact that the challenges that we have in the gaps in infrastructure and also the gaps in our human capital, the doctors and the allied healthcare workers. Dr. Ramesh Loganathan very eloquently explained how we have to focus on the big problems and areas of big impact rather than diluting ourselves, and the need for AI and cutting edge technology to leverage problems, and technology will help us leapfrog in the care continuum. And my friend and guru Jitendra Sharma ji, Dr. Jitendra Sharma, explained how AMTSZ is a diamond in our system to give us a lot of competitive advantage, and how quality plays a key part. If you have to lead to better outcomes, you have to lead the world, quality and reliability are the foundations. So I just want to look at certain thoughts and ideas at a macro level to how to make our Bharat, India, ATMANIRBHAR BHARAT, as our Honorable Prime Minister has called out, and how can we give health to India and Indians in a way that increases productivity. I can tell you India is the capital of non-communicable diseases. It's not an honor that we are proud of. 60% or more of the mortality is coming from, and the morbidity is even more impactful. There's a study done by the Harvard Medical School which shows that over the next 20 years, close to 5 trillion of damage to the economy can happen from these NCDs. Remember, we are at close to a 3 trillion economy. And if you are losing more than our total GDP over the next few years, that's a big deflator for our growth, which we cannot afford. So healthy India is successful India. And I want to start by providing a macro analysis at Asia Pacific level. I also lead the largest medical vertical of Medtronic in Asia Pacific, which is the medical surgical division. And if you look at it, and I separate the emerging and the developed markets, out of the 2.5 billion of population, we have the Southeast Asian developing countries, and India has majority of the population. And if you see the market in healthcare spend, it's about 1.3. This is a little outdated. It can be closer to 1.5 trillion of spend in healthcare. It's happening. And the medical device market in Asia Pac is getting closer to 100 billion. This is excluding our neighbor on the north. What I want to mention here is that we have more than close to 100 million diabetes patients. We have significant unmet need in many NCDs and other conditions. And what I want to call out, which is, I think it's a big motivation factor that we have to take out from this bad news, is that we have more than 56% of the population of APAC, but we only have close to 9% of the APAC market in medical devices, close to that 7.5, 8 billion that Dr. Jitendra Sharma mentioned. And it's a 2.26% of GDP. If, for instance, if Japan or ANZ are developed countries, but their spend in healthcare is significantly high. So our help to India, creating a vibrant Atmanirbhar Bharat in healthcare technology, can only start where we focus and prioritize healthcare. Ayushman Bharat is a laudable, inspiring scheme, but the funding has to be provided. We need to have the debate to see how insurance, the right capitalization models, and the right funding models are there so that the government spending in healthcare moves from 1.29% to 2.5 or 3%. And as we develop GDP and our GDP per capita, healthcare will become a priority and will become a driver of economic growth and welfare for everyone in India. And if I look at the top companies in the world, we are humble honor being the largest medical technology company in the world. But what I want to call out in this slide is that almost every company here, I can talk about my company, I don't want to talk about the others, but my feeling is that most of the companies, India currently represents less than 1% of the global turnover. Mind you, we have more than 16, 17% of global population, correct? You do the math and you can find out. But we have less than 1% of the innovative medical technologies and even the overall medical technology market. So I think what we need to do as part of our journey, in my view, is to ensure that each and every one of these companies, each and every one of the top 100 companies, we have to figure out a way how we can collaborate with them, how we can attract them into India to invest in India. Because the India market, less than 1% for global transnational R&D companies, we have to be in India for the world. How can India play a much bigger part in the global value chain for medical devices and technology? Dr. Ramesh Loganathan explained about the collaboration with Intel. My chairman, Dr. Omar Ishraq, is also the chairman of Intel. So we're kind of brothers or sisters, and I'm happy for the collaboration. So even companies like Intel and other global technology companies, we have to attract to invest in our healthcare so that when India plays a bigger part in the global value chain for healthcare, we will also have advantages of cost. We will have the advantages of value adding. And for me, success will be when India contributes 10% of the global value chain for healthcare in medical technology and health technology. Just a couple of 1 minute about Medtronic. What Dr. Jitendra Sharma eloquently mentioned about quality and reliability as a cornerstone of our existence and success, that is rightly so. We have close to 1 lakh of employees, out of the more than 10,000 PhDs and scientists of advanced standing and fellows, active in 160 countries with 76 manufacturing plants and 21 lab and research sites. What gives me the real pride is that recently we worked with our central board of directors to ensure that we get 1,200 crores of funding to set up the world's second largest R&D hub outside the United States in India, in Hyderabad. So that's a great moment of pride for us that Medtronic is creating the second largest, in the sense after the US, the largest outside the US R&D hub in India. It's a vote for India. It's a recognition of the talent and the capability of the India technology, science and physicians in India and surgeons. And the fact that this is the core competency theory in my view. Without doing everything under the realm of healthcare, we need to identify areas where we have a core competence. Our own professor, Dr. C.K. Prahalad, he popularized or he articulated very strongly the theory of core competency. And my humble submission to you is that let's look at areas where we have core competency. Let's not do what other 160 countries are doing. And let's ensure that technology and human capital play a key part. If you look at medical technology, there are quite a few differences from pharma. And even our senior policy makers, Dr. Sharma, and we have learned leaders like Dr. Paul and Dr. Balram Bhargava, but a lot of our executives involved in healthcare related areas do not understand the differentiation. Medical technology, the clock speed is much faster, and a lot of it depends on miniaturization, battery technology, material sciences, and a significant fast clock speed versus even pharmaceuticals. I worked in pharmaceutical, a global major, for 13 years in Sweden, in South Africa, in South Korea. And I've had an opportunity to look at both developed and emerging markets. And I can tell you, technology can allow us to leapfrog in the care continuum. But the various aspects of it has to fit together, and quality and reliability, clinical research, and reporting of adverse events and monitoring of performance is crucial. One thing we should put an oath is that everything should be outcome-based. It's moving from episode of care to outcome-based model is key. And that is how India can differentiate to be a center of excellence, a country of excellence. If I were to go into certain specific areas, as I look at medical technology, microelectronics, what is held in that hand, right hand, is our latest pacemaker. The initial pacemaker was the size of a transistor radio. It was not implanted. 70 years ago that our founder invented. Later on, it became the size of our palm, inside of our palm. But the latest technology introduced about 4 or 5 years ago is the size of a vitamin capsule without any leads. It's more of microelectronics miniaturization than anything. We also have to look at material sciences to see how they can be addressed and leveraged from a global leverage. Power, battery technology, sensors, tissue regeneration, imaging and visualization equipment where there is a lot of data also involved, because AI does guide some of this, the angle of introduction of a spinal implant or of a robotic arm. And the data collection, big analytics and communication platform, we spoke quite at length, and Dr. Raghunathan also mentioned very, very well. And I think this is an area I believe India can play a significant role. So I think recently we signed a protocol of creating 10 centers of excellence with Apollo hospitals. As you know, Apollo is a leading healthcare provider in India with the long years of heritage. Now they are also disrupting themselves with AI with our support. What is exciting is that, in every day in India, close to 4,500 people are afflicted by stroke, and not even 2 to 3% are getting the right care at the right time, which means the rest either die or have lifelong paralysis, which is a significant, emotional challenge for the family and a loss to the economy because of the lost productivity of the patient and the caregiver. Dr. Reddy explained an instance where a person, 44-year-old patient, reached at 2 a.m. in a hospital of Apollo in Karimnagar. Normally, the diagnosis and treatment could have got delayed because diagnosis is not easy. But using this artificial intelligence technology, the images were sent to a specialist in Hyderabad who looked at the level of the lesion, the level of the impact to the brain, and the diagnosis and treatment were given, and the patient started talking within minutes. So the diagnosis time reduction from 60 to 2 minutes is revolutionary. And I would say AI is an area where India can play a significant part, and esteemed institutions like PGI and the work that CIBioD is doing can be targeted in this direction. So I want to point a few areas where we can start looking at areas of core competence and drive it forward. Start with R&D, I would say. That is an area we produce largest numbers of STEM graduates in science, technology, and we have respected physicians and surgeons who are of global standing and global recognition. We are second to none, I would say. So can we look at areas of telehealth? Can we really focus on the effectiveness of our primary health centers? Because primary health center is where we have to attract our patients to come and to look at their health-seeking behaviors in time before delayed diagnosis, because many diagnoses in areas like cancer and renal and even NCDs happen too late. We can focus on preventive and also supportive environment to do technology-based, telehealth-based PhDs, diagnostics, data leverage. We need to work together to create the care pathways and the right AI and digital tools. Our human capital, our capabilities can be leveraged. And in my view, clinical research, outcome analysis plays a big part. We can own the space, in my view, of clinical research, not just in doing the clinical research, but the data management, interpretation, meta-analysis, and even in terms of publication and follow-up. We can also work on tailored products and become, through that, R&D and clinical global AI leader I think we can certainly attract manufacturing in India, for India, and in India for the world. And before I end, I am very keen to support CIBioD to ensure that the venture and the collaboration achieve success. The speakers who spoke before me are all eminent in their field. So we need a collaboration, industry academia partnership, and trust-based collaboration between these august agencies. I'm ready to support hackathons, innovation summits, and bring in our global teams also to collaborate to drive a healthy ecosystem and handholding. I believe that healthcare can only be achieved through collaboration, and we can take healthcare further together. And India playing a greater role in global value chain, achieving an aspirational 10% of the global value chain for medical technology must be our vision. And I wish CIBioD, the ICMR Center for Innovation and Biodesign, all the very best. Thank you very much. Jai Hind. And if there are any questions, and if you have time, I'm ready to take it. Jai Hind, and proud about ATMANIRBHAR BHARAT and committed to success of ATMANIRBHAR BHARAT and CIBioD. Thank you.
Thank you, Dr. Madan, for your remarks and motivation. I would like to invite now Shri Amar Sable ji to address our audience.
Namaskar.
Namaskar, sir.
I welcome all the intellectual dignitaries to this international online summit on ATMANIRBHAR BHARAT India. As manufacturing hub for Global Health Summit, being tested positive for COVID and having throat infection, I am not able to express out my emotion fully. I would like to give my best wishes to this summit and thanks to all dignitaries for connecting today. Healthy Globe Smart Hospital Virtual Clinic and Tata Communication Limited are jointly working in telemedicine, virtual clinic, doctor to home, world medical tourism, and mobile clinic for remote and industry. We believe that definitely this collaboration is going to contribute in developing the health service in the country. Thank you.
Thank you, sir. Now I invite Ramdev Krishnan ji to say a few words.
Thank you so much, first of all, to Mr. Dr. Garg Saab, who has accepted us, and Tatacom being proud to work with CIBioD, and of course the entire team for giving this opportunity. We had a great speech from all the speakers, especially Dr. Vinod Kumar ji, who has covered the statistic, what in India is, what we need to do. And Mr. Ramesh Loganathan about AI solution, last Jitendra Sharma ji, which is a very innovative approach. And the AMT Izzat Center, I'm gone through earlier, but what happened when he spelled out with his aspiration of come in the morning and take out the device or the required output in the evening, that's a very good process. We would love to visit and see how do we collaborate. And the final touch by Dr. Madan Krishnan ji, or Mr. Madan Krishnan ji, corrected early in the thing, the Metronics, he gave us, he rather woke us everything with one slide where 1% of an Indian manufacturer is in the whole, space. So I would love to collaborate, tell us what Tatacom can do. Everyone might know what is Tatacom is. Tata brand stands for, of course, you all know the dignity, honesty, integrity, and all that. They always solve the problem, right? The industry is always thinking of solving for India, what is the problem and the solution towards it. So we would like to collaborate with various industries like Mr. Sushil Rana showed us an interest that we'll collaborate and go for rural clinic. Thank you so much for honoring us. This is just a start. We would work together and make sure whatever gap we can collaborate and work together. Thank you once again.
Thank you, sir. Lastly, I invite Sushil Rana ji to share his views, please.
Honorable members on the dais, CIBioD leadership, Dr. Shalini, I'd like to thank everyone for having me here and the recognition that you all have provided us. We at RMS as an Indian medical organization are definitely echo with the thought of this session for India as a global hub for medical devices. As mentioned by Mr. Krishnan, Dr. Jitendra Sharma, definitely there is a need of indigenous manufactured devices for the country. We are dependent upon largely upon imports. More than 80% of the medical devices to be used in the country. So definitely there is a need of strategic partnership between the various players like top medical institutes, engineering institutes, and the industry to develop that ecosystem. So finally, I'll not take much time. I'd like to thank you everyone for this honor and privilege to have this. Thank you so much.
Thank you, Sushil ji. I invite Dr. Varinder Garg to propose vote of thanks.
On the behalf of Team CIBioD, I, Dr. Varinder Garg, Principal Investigator, Center for Innovation and Biodesign, take proud in presenting the vote of thanks to all of the dignitaries and our audience. One thing I want to mention that today's session is special because this is not only a discussion session. On the dais, we had Shri Madan Krishnan ji. Madan ji has supported us immensely for a hub and spoke telecardiology model in Bathinda. So that is also one of the pilot project in Northern India in implementing the high-end technology in bringing the healthcare affordably and accessible to the marginal section of the society in the rural area, in the early diagnosis of the cardiac diseases and timely intervention, thus reducing the mortality and morbidity and cost also. And Sable ji, Ramdev Krishan ji, Sushil Rana ji, they are on the dais. So we are doing one project of setting up virtual tele-clinics in the Himachal, in the remote areas of the difficult terrain of Himachal. 5 clinics we are going to establish in the next month. 2 are already working at Una and Sangrur. So this session, for your esteemed presence, for your enlightening oration, as well as for your continuous guidance and cooperation in the field, that is much more beyond just a summit or a session. So I hope that in future our collaboration will bring much more with synergy and with accuracy. So we will be able to practically achieve the goal of ATMANIRBHAR BHARAT. I am thankful to Madan Krishnan ji for his offer for hackathon. Soon we will be materializing the hackathon as well as the clinical and further collaboration between the Center of Innovation and Biodesign and Medtronic and Tata Communication and RMS and Sable ji. So I am thankful to all of you because today's session is close to my heart and I am extremely grateful for the practical projects we are already doing in the field, and these projects will be the one of the pioneer projects and the working as a lamp post for the entire medical fraternity as well as technocrat fraternity to follow the suite. Thank you, Ji. Thank you very much.
Thank you all for joining, and now we are going to end this session. Thank you.
Thank you so much.
Madan Krishan ji, I had visited Medtronic 7-8 years back in Seattle.
Oh, wonderful.
I did one project in collaboration with this, the one professor from University of Glasgow, Professor Peter McFarlane.
Okay, interesting.
So
Very nice.
We collected the ECG database of normal, healthy humans in India, and we have the evaluation also by your ECG machine. I got 3-4 ECG machine from Medtronics as a compliment.
Thank you. I think I really thank you for meeting you through CIBioD and Dr. Garg. So look forward to staying in touch. Namaste.
Sir, I will share the details with you.
Okay.